Hey, hello, my name is MarkAlian Dery, and you are listening to Noise Filter Show. And today we're going to be talking about three stories. Three stories. We're going to talk about some recent Supreme Court cases that have been decided upon. Next, we're going to talk about the Medicaid cuts that have been happening. And last, we're going to talk about what's happening at the CDC. Hey, what is happening at the CDC? So let's start off by unpacking the two Supreme Court cases that will shape the future of healthcare access in America. That's Kennedy versus Braidwood Management and Medina versus Planned Parenthood South Atlantic. So, first, the basics. In Kennedy versus Braidwood Management, the Supreme Court was asked whether the Affordable Care Act's requirements for insurers to cover preventative services like cancer screenings and HIV prevention meds was constitutional. The challenge argued that the experts recommending these services weren't properly appointed, and thus the recommendations shouldn't be binding to insurers. In Medina versus Planned Parenthood South Atlantic, the issue is whether states can exclude Planned Parenthood from their Medicaid programs, effectively allowing states to deny Medicaid patients access to care at Planned Parenthood clinics. So let's break down what happened and why it matters. So, for the first case, the Kennedy versus Braidwood Management, this is actually a win for preventative care. The Supreme Court ruled 6-3 to uphold the ACA's preventative services mandate. That means insurance companies must keep covering things like PrEP for HIV prevention. Yes, we love PrEP, cancer screenings, and immunizations, all of that without out of pocket costs for patients. Why is this a big deal? Because preventative care saves lives and money. And when people can access screenings and medications early, we can catch diseases sooner, treat them more effectively, and avoid catastrophic costs down the road. This is especially important for marginalized communities here in the US, particularly communities of color, LGBTQ plus, and low income Americans who already face massive barriers to care. Without these protections, millions would have to choose between paying rent or paying for a mammogram or HIV prevention. So the court decision keeps open for everyone, not just the wealthy, the ability to get care to stay healthy. It's a win for public health and it's a step toward leveling the playing field in a system that too often leaves the most vulnerable behind. All right, that's the good news for today. Now, the rest of it is massive, not good news. Let's start with Medina versus Planned Parenthood, states' rights versus patient rights. All right, so here the court sided with the states. Boo, giving them the green light to exclude Planned Parenthood from Medicaid programs. In plain terms, what this states is this: states can now block Medicaid patients from getting care at Planned Parenthood clinics, even if those clinics are the only accessible provider in the area. And we're not talking about abortion, yo, not at all. We're talking about basic health care. Planned Parenthood provides cancer screenings, birth control, STI testing, and much, much more. When states cut them out, low income patients disproportionately, women of color, lose access to essential care. So, from a justice perspective, this decision deepens health inequities. It lets states draw lines about who deserves care and who doesn't, often along racial and economic divides. And the result: more barriers, worse health outcomes, and a healthcare system that works for some but not for all. So, in summary, at least for these two cases, Kennedy versus Braidwood, this preserves a critical safety net for preventative care, protecting millions from financial and health risks, whereas Medina versus Planned Parenthood does the exact opposite. It gives states the power to deny care to those who need it the most. Together, these cases show the ongoing battle over who gets access to healthcare in America and why the fight for health equity is far from over. So let's turn to Medicaid. What's happening? Let's start with the basics. Republican lawmakers, backed by former President Trump, are pushing a sweeping budget bill that would dramatically cut Medicaid, the program that provides health coverage for over 71 million low income Americans. These folks are the people that I take care of here in New Orleans. The House version proposes at least $625 billion in cuts, and the Senate is considering even deeper reductions. Some estimates suggest up to 8.6 million people will lose coverage if these cuts go through. What's in the bill? The proposals include new work requirements, which we know that other states have seen and have done and have not. They don't work. They're not meant to work. They're meant to frustrate. They're meant to obstruct. Okay, so these are new work requirements that able-bodied adults would have to work at least 80 hours a month until the age of 65 to keep their benefits. There are also more frequent eligibility checks, new cost sharing requirements, meaning some Medicaid patients would pay up to $35 per service. Certainly, in the world that I live in, having to pay $35 every time you're going to go somewhere or do something, my patients just will not be able to afford it. They will not seek those services if they have to swipe a card. While there are exemptions for parents, people with disabilities, and some essential services, experts warn, not surprisingly, that these changes could still push millions off the rolls, especially those who struggle with paperwork or unstable jobs. The Senate bill also targets the taxes that states use to fund their share of Medicaid, planning to lower the allowable provider tax rate and freeze new taxes. This is actually a big deal for states that rely on these funds to keep Medicaid afloat, especially rural hospitals. It's actually a nod to moderate Republicans from those from rural states. The latest version of this bill includes $25 billion stabilization fund for rural hospitals and delay some of the provider tax cuts until 2028. So, in essence, what did they do here? They basically just created some very, very sweet offerings here in the bill, particularly for red states or for Republicans that are from red states. So, this way, at least, they're not going to feel the cuts so bad. Is that fair? Of course not. But we're in America 2025. What is fair anymore? Anyway, here's where politics get interesting. Some Republican senators are pushing back hard, worried about the fallback at home. Senator Tom Tillis of North Carolina, for example, warned that 600,000 of his constituents could lose coverage, and that would be disastrous for the GOP in the midterms. The bill's so contentious that as of this weekend, Republican leaders still don't have the votes to bring to the Senate floor. And as I'm recording this on Saturday, the 28th, they're actually in the process of trying to gin up votes right now. So what does this mean for 2026? Medicaid is a lifeline for millions, and cuts this deep are already fueling attack ads and grassroots mobilization. The debate is exposing deep divides, not just between parties, but within the GOP itself, only over how far to go and shrinking the safety net. With so many Americans, healthcare on the line, expect Medicaid to be a defining issue in the next election cycle. In short, the fight over Medicaid isn't just about budgets, it's about real people, real coverage, real political consequences. Let's close off by talking about CDC delays in funding. This is something that's impacting me and certainly the people that I know here in New Orleans personally. So, state and local health departments across the country are facing a significant funding shortfall, and the primary cause is the delayed allocation of funds from the CDC. Typically, the CDC receives its budget from the Congress and quickly distributes the grants to health departments, which then partner with local organizations to deliver critical public health services. But this year, the CDC still hasn't received its whole 2025 funding months after it was due, leaving health departments in limbo and scrambling to keep programs up and running. Instead of these annual grants, the CDC is just getting 30 days of funding at a time, a situation one staffer referred to as recession by inertia. I'm sorry, rescission by inertia. With no clear communication about the delays, some local health departments are already laying off staff, pausing services, and warning of bigger cuts ahead. If the money doesn't arrive soon, there's a real risk that key public health programs will stall and unspent funds would even be lost at the end of the fiscal year. So, the bottom line, without stable, timely CDC funding, the backbone of America's public health system is at risk just when we need it most. Right now, the U.S. public health system is under coordinated attack from multiple directions. While the Supreme Court's Kennedy versus Braidwood decision preserved free preventative care for millions, Congress is simultaneously threatening deep Medicaid cuts that would strip coverage from millions more people and destabilize hospitals nationwide. The Supreme Court has also given states the green light to defund Planned Parenthood, cutting off essential care like cancer screenings and birth control for low income patients, especially women of color. And on top of that, chronic CDC funding delays are forcing local health departments to lay off staff and pause life saving programs. These aren't isolated incidents. These are part of a broader squeeze that undermines access, weakens safety nets, and puts the health of the most vulnerable Americans at risk. The message is clear. America's public health infrastructure is being chipped away just when we need it the most. My name is MarkAlian, and I'm an infectious diseases physician in New Orleans, Louisiana, serving the Medicaid population here. You can find more information at noisefiltershow.com and whivfm.org, which is a community radio station dedicated to human rights and social justice. Like and comment. Don't delay. Help this video find its way. Peace out, everybody. End all wars. Hello, my name is Dr. MarkAlian. I'm an infectious diseases physician here in New Orleans, Louisiana. We're going to talk about today a groundbreaking study that was published in the prestigious Annals of Internal Medicine by researchers from Harvard and other top institutions. And in the study, it reveals that proposed federal Medicaid cuts in this so-called big, beautiful bill would devastate healthcare access while causing preventable deaths across America. Imagine a country where overnight, the equivalent of every single person in the city the size of Los Angeles loses their health insurance. That's what's at stake if Congress's proposed Medicaid cuts become law. Millions of our neighbors, friends, and family members will be left without the basic security of knowing when they can see a doctor, whether they can see a doctor when they're sick or get medicine when they need it. But this isn't just about numbers on a spreadsheet. It's about real people. Picture a packed football stadium with every seat filled with people who could no longer afford to visit their doctor or get a mammogram or pick up a prescription. These are parents who will have to choose between groceries and insulin, or children who will go to bed at night with untreated asthma because their families can't pay for care. And while these devastating cuts are being made to programs that help the most vulnerable, the same legislation is handing out a massive tax break to the wealthiest Americans and biggest corporations. It's a classic case of robbing the poor to pay the rich, taking away health and dignity from those who need it the most, all to pad the pockets of those who already have more than enough. The consequences are deadly serious. The study estimates that every year people will die from losing Medicaid, enough people to fill an entire small town. Lives cut short not by disease, but by deliberate policy choices. And for those who survive, the burden of Medicaid debt, untreated illness, and lost opportunities will ripple through families and communities for generations. Make no mistake, the cuts represent a deliberate attempt to destabilize our entire healthcare system, which is already hanging on by a thread. Hospitals serving vulnerable communities will be forced to close. Emergency rooms will become even more overwhelmed. Healthcare workers already burnt out from the pandemic will face impossible choices about who receives care. The suffering we'll witness won't be confined to individual families. It will tear at the very fabric of our society. When millions lose access to health care, we'll see increases in homelessness, job losses, bankruptcy, and even crime as desperation takes hold. The economic and social instability created will reach far beyond health outcomes, threatening the stability and cohesion of entire communities. This is not just a policy debate, it's a moral crisis. Healthcare should be a right, not a privilege reserved for the wealthy. When we strip coverage from millions, we deepen the divide between rich and poor, and we betray the promise of justice and equity that should be at the very heart of our society. We must speak out, we must demand better, because our lives and our values are on the line. My name is MarkAlian. I'm an infectious diseases physician in New Orleans, serving the Medicaid population here. You can find more information at noisefiltershow.com and at whivfm.org, which is a community radio station dedicated to human rights and social justice. Like and comment, don't delay. Help this video find its way. Peace out and end all wars. All right. Hello, my name is MarkAlian. I'm an infectious diseases physician in New Orleans, Louisiana. And today we're facing a public health emergency that isn't caused by a virus or a natural disaster, but by the decisions made in Congress that could devastate healthcare in America, especially in rural communities. So let's talk about what's happening today. Congress is considering deep cuts to Medicaid, the program that provides health coverage for millions of Americans, including nearly half of all children, 1 in 5 adults in small towns and rural areas. And if these cuts become law, it's not just a line item in a budget, it's a shockwave that will ripple through every corner of our country. To put this in perspective, imagine every single person in a state like Nebraska suddenly losing their health insurance. That's the scale of loss we're talking about. 1.8 million people in rural communities alone could lose Medicaid coverage by 2034. That's enough to fill every major concert hall, theater, and community center in the Midwest all at once. But the crisis doesn't stop there with individual losing coverage. Rural hospitals already struggling to keep their doors open would be pushed to the brink. These hospitals are the heartbeats of their communities, often the largest employer, and the only place for miles where you can get emergency care, deliver a baby, or receive treatment for chronic conditions. With the proposed Medicaid cuts, independent rural hospitals could lose an average of over half of their yearly income. That's like taking away every dollar from a family's paycheck for 6 months and expecting them to survive. The numbers are staggering. More than 700 independent rural hospitals are at risk, and 55 more could tip into financial crisis in just the next year, leaving hundreds of communities without a hospital at all. Imagine a map of America with hundreds of towns suddenly losing their emergency room, ambulances forced to drive hours further for heart attacks and injuries, with nowhere to go, and maternity wards being shuttered, forcing expectant mothers to travel impossible distances to deliver their babies. This isn't just a side effect, it's a deliberate attempt to destabilize our healthcare system. These cuts would inject chaos and uncertainty into a system already hanging on by a thread. Hospitals will close, critical services will disappear, and healthcare workers will be forced to leave their communities or their professions altogether. The suffering will go far beyond health. When hospitals close, jobs vanish, local economies collapse, and families are forced to move away just to survive. The ripple effects will destabilize entire regions, increasing unemployment, driving down incomes, and tearing down the social fabric that holds rural America together. So let's be clear, these cuts aren't about making healthcare better or more efficient. While millions of Americans lose coverage and hospitals close, the same legislation hands out massive tax breaks to the wealthiest Americans and the biggest corporations. It's a transfer of resources from the most vulnerable to those that need it the least, a theft of health and hope from rural families to benefit the already privileged. This is a moment of reckoning for our country. If we allow these Medicaid cuts to go forward, we're not just risking the health of millions, we're risking the future of hundreds of communities and the stability of our entire healthcare system. We must stand up and speak out and demand that healthcare remains a right for all, not just the privilege for the few. My name is MarkAlian Dery, and I'm an infectious diseases physician in New Orleans, serving the Medicaid population here. You can find more information at noisefiltershow.com and whivfm.org, which is a community radio station dedicated to human rights and social justice. Like and comment, don't delay. Help this video find its way. Peace out and end all wars.